Well, while countries like those in the EU fight about which vaccines to use, others like Brazil don't exactly have that luxury, and hope there is running out. The Pan American Health Organization says Brazil is still reporting record high infection rates a year into this pandemic. The death toll is the second highest in the world, and hospital ICU stays are nearly full. Matt Rivers is following this story from Rio de Janeiro.
Well, it was just about 1 year ago that Brazil recorded its very first death from the coronavirus, and right now things are unfortunately worse than they have ever been. It was on Wednesday that Brazilian health officials announced that a new single-day record had been set in terms of coronavirus cases recorded. More than 90,000 cases recorded on Wednesday. Health officials also reported more than 2,600 additional deaths from the coronavirus. That is second most all time for a single day, behind the previous record, which was set just yesterday on Tuesday. Meanwhile, we heard from the country's most important medical research institute, the Oswaldo Cruz Foundation, also known as Fiocruz. They talked about the current situation, talking about how grave it is, and they said, quote, the situation is the greatest health and hospital collapse in the history of Brazil. And if you look across the country right now, the latest analysis from CNN shows all but one of 26 Brazilian states showing ICU capacities in those hospitals at 80% or more. Matt Rivers, CNN, Rio de Janeiro, Brazil.
We're now joined by Dr. Arthur Brito. He's an infectious disease specialist in Sao Paulo. Thanks so much for your time. You've been working as an infectious disease specialist in COVID wards and ICU units at 3 major hospitals there. We know the numbers are awful. Just describe what you're seeing on the front lines.
Yeah, Lynda, good morning to you too and to everyone. At least morning in Brazil, I don't know over there, but yes, we are seeing now it's the situation is worse than it's ever been, actually. I'm in São Paulo, so I have the luxury of being in a state that's got much more infrastructure than other places in Brazil, like we could see in Manaus, in the Amazon, where the system collapsed in November, and even oxygen was lacking from ICU department. So it was a terrifying situation. But now even in Sao Paulo, in all the places I work in, we don't have spaces, beds in hospitals anymore. So people are actually in private, like fancy hospitals in Brazil, like expensive hospitals, because we have a public and also a private health system. So even in those places, they don't have beds anymore, not even ward beds or ICU beds. So we are now beginning to be afraid of medicines, important medicines like sedatives, not being going short, not being we won't be able to give them to the patient. So that's our current situation in São Paulo and all over Brazil.
We know that more than 280,000 people have died in Brazil as a result of COVID. And every single day we're seeing the daily death record toll break the last every single day. Here in the US, we obviously have seen inequality play out as a factor. You mentioned it briefly there. Can you talk to us more about how inequality is playing out there?
Yeah, I think we have a similar situation as the US, but we are a country with even greater inequality. So it's even worse, actually, because the factors are all the same. I mean, of course, all our population is Latin because we are Brazilians, but the Black population suffers more. And the social inequality in Brazil is bizarre. So as I said, we have a public and a private system. And although the public system, it's been a relief for 80% of the Brazilian population depends only on the public system. So if we didn't have any public system, we would be much worse than we are now. But of course, the private system has got much more money. So if you don't have a private insurance and you need a hospital, you're dealing with even worse conditions now. So we have different death rates within different hospitals. in a sense that we are not on the same boat in Brazil. That's been a reality. I work in 2 private and 1 public hospital, so I can see that in an everyday basis.
We've seen since the start of the pandemic, Brazil's President Jair Bolsonaro continuing to downplay the pandemic, downplay the problem. And in the last year, as a result, in part, you've had 4 different health ministers having to deal with it. No doubt that has made a terrible situation even more difficult to manage.
No, that's more clear by the day. I mean, we have a president that doesn't understand the situation, doesn't want to understand the situation, doesn't empathize with regular Brazilian people, who criticized most of the measures that all over the world are being used to slow the pace of the pandemic and try to control the virus at least a little bit, so we didn't get to the situation we are now. So, of course, we have even scientific papers that shows that countries who have leaders who undermined the pandemic did much worse. And I think Brazil is the biggest case in the world. So, fortunately, we are not one of the places that have the least infrastructure. We have some infrastructure. So, until now, we've been able to control things with opening more beds, more hospitals, but of course that's got a limit, because the spread of the virus is much faster than the capacity we have to open new places, to put new patients, and it got to a point where you can open new beds, but you don't have people to work on them. Although we could vaccinate all Brazilian health workers until now, we already did it, but the number of professionals is not enough.
All right, Dr. Arthur Brito, we really appreciate your perspective there in Sao Paulo and wish you all the best. Thanks so much.
Thank you, Lynda, and thank you all.